At Kaiser, we feel like maybe some of you go to the doctor hopefully once a year to your checkups, but sometimes not. But your health care is every day of the year. So how can we make health easy for you? How can it be a part of your life to make those easy decisions right? So we really see extending on that. We also know there's a lot of transformation, technology, innovation helping in healthcare. We know with the exchanges too, that it's really now becoming out of your pocket. So how can we make it of value? So we really want to increase that relationship with you in multiple and many ways. One thing you might not know about us is that we're the largest nonprofit health plan. We invest in our communities. I think some of you might have seen that we've invested here at this center as well, but we're across multiple states. We're integrated healthcare all the way from our hospitals to our pharmacies to our optical. We even have a dental plan in the Northwest. If we were to carve out our pharmacies, we'd be the 5th largest pharmacy in the country. So we're really working to understand and take care of your total health from that path. We're also the largest electronic medical record in having all that data in the private sector. Our Sidney Garfield Innovation Center is actually open to the public. You can actually look on it online. You can take a tour of the center. You can also look at the prototypes, or if it's some area you want to explore as well. I just wanted to say we have Tom Eppenberger, one of our innovation lab leaders in the back here on our table from that. But we're really looking to extend the care. And what we found and what we heard from people is when they think healthcare, they think that left-hand side, red tape, invoices, bureaucracy, confusion, sick care. But really what we want to represent is total health, where we're there with you every day, looking at your wellness when you're well and when you're sick. How can we help support the relationship? We also know that things are changing. Your expectations of us are changing. As we look at it, it's really become very digital. Whether it's the emails, your Facebook, your Skype, you really want your healthcare information at your fingertips. You really want that personalization. You want to manage your appointments. You want to book it online. In Northern California, you're able to do video visits now. You can do phone visits. You can email your doctor. You can search things online. We have a mobile app, but it's really about communicating where you want your healthcare and personalizing it for you. As I was mentioning the transformation that's happening, we've seen the transformation in the financial institutions area, going from banking to ATMs to online. As my former colleagues just presented, we see that transformation happening in our education sector as well, going from the classrooms to massive online courses. What we envision for healthcare is that you're going to have that choice as well. It's not about always coming to the hospital and the doctor's office, but us coming to you, whether it's in your community centers, your employer work sites, or in your home via virtual. And when we say it's expanding from a digital health side, it's really about access, convenience, quality, affordable health and wellness for you. So really looking at those kind of levels of engagement. How many of you have emailed your doctor or phone visit or video visit? How many of you done that? Oh, great, wonderful. And it's that level of convenience of not finding parking, waiting in line, having it at your time, and the way you want it. As I was mentioning before, Kaiser Permanente has the largest electronic medical record. It is the largest private one. But with this information, where we're going across the spectrum of understanding you with your doctors, your hospital, your pharmacy, your imaging, your labs, we're now trying to make that accessible to you wherever you are. Whether it's through our website, mobile, social, if you want to share it with your caregiver or family member, voice and video. So we really want to make it at your preference and your choice of how you like to share and engage on your health. When we looked at it, what you saw in that first scene of that video was how we kind of imagining care anywhere, and really on that virtual environment. She was in a skiing accident. We have mobile health vehicles that do exploration right now. And you also saw a home environment. What we've been really great, and you see just even with our facilities, Kaiser's great with hospitals and clinics, but we really want to expand into the other areas of virtual care. Now this is just a few of the things we're piloting and prototyping and looking at. We've been looking into robotics. So we actually, our pill distribution pharmacy is actually a lot of it is robotics and pill distribution in our distribution center. You also see the courier robot. We have several in Southern California that carry about 500 pounds of delivery, and AutoCAD drawing, and it automatically goes to where you want. It's very polite. It even can take elevators from that, but it's really about the efficiency from that standpoint. Remote monitoring and vital signs, what we're really seeing is a whole bunch of digital remote monitoring, whether it's your weight scale, your activity band, your heart monitor, your temperature, your UV. So how can we help when you're remote to us, for us to monitor your health? We're also looking at mobile diagnostics. That first one on the left there that looks like a wand is actually a mobile ultrasound. So now imagine you might have been that skier and that just fell, and you're on a ski slope and you're seeing us at Kaiser, and you might not have the time or it's painful for you to move. Wouldn't it be easier for us to do a mobile ultrasound with you right there and be able to assess the situation rather than trying to transport you to the nearest hospital and x-ray machine? As we're also looking, that middle one is actually looking at your heart, and the third one is your glucose. One interesting thing about medication adherence is if you look at the US as a whole, half of the population doesn't take the right meds at the right time for the right reason. And so we're really looking at medication adherence as a possibility to partner in this area, whether it's a smart pill with a chip on it to ensure you've digested it, to opening it, or to reminding you that you've on your phone or your smart watch that it's time to take your medication. How many of you ever seen WordLens? It's purchased by Google. Okay, a couple of you. This is about translation. It's now translating any sign into multiple languages. So now you can imagine with your businesses, at your schools, where you're going, and we're looking at it for our clinics, our health education material, for it to translate into multiple languages for you. And it's a free app that's downloaded in iTunes stores. And then emergency response systems as well. So we've been investigating, exploring, partnering, and looking at these. These are just a few examples on that. I wanted to kind of poll the audience. How many of you are working with a city, public sector type group? Okay. How many of you are in startups, innovators, dreaming of a startup? Okay, great. How many of you are in private sector, large companies, mid-size, small? Okay, great. Well, great diversity as you're going. We really see at Kaiser there's a lot of opportunity in healthcare to innovate from all different sectors. And it's really going to take the transformation of all of us working together to transform that. From the public sector on how we do policy and administrate that in areas, on the private sector where we can partner in and collaborate, but you're also our customer for your employees and your health plans. And for the innovators, what you see is just a small sampling of the innovation happening in healthcare and where there's possible opportunity for you as well. Are there any questions that you have at all? Yes.
Are you going to, when you say that people can create their own way of how the medicine works, customize things for them, are you going to enable people to have access to global medicinal things that actually work outside of the traditional Western model, like Chinese medicine, other forms of medicine that actually do work?
So we've been actually exploring that too as well. And so what we found too is there's a lot of social groups like, we're looking at smart patients. Do you know about smart patients? It's basically looking at our cancer population and looking at alternative care ways, and they're actually sharing their best practices on alternative ways and encouraging it from that standpoint. We do kind of chiropractic and certain alternative ways that we explored, and as well as part of our benefits from that plan. But we are looking at how do you curate ones. What we're also finding is based on your genomics, certain things are effective for you and not maybe for the next person, even if they have the same disease state. We're now trying to tie your genomics with your electronic medical record, with your family history, with your lifestyle, and seeing what's the most effective kind of treatment. Yes.
We've heard a lot about innovation technology. I was wondering if you had any insights on how you combine hardware and software with wetware. In other words, the human brain and the human heart. An example is there's been recent reports in East Bay media about Kaiser creating new facilities with a heavy emphasis on technology with an opportunity to perhaps balance it with the need for more human intervention. What do you have to say about that?
So we've actually done quite a few time and motion studies, and what we were finding with some of our care teams, that they were being pulled to non-clinical work. So we're trying to use the technology to enable the clinical work. So one example might be you're in a hospital, you've been admitted to a hospital and gone through a surgery. Right now you have one button. It ends up being a nurse call button, but you really want a glass of water, or you might need to, something might have spilled in your room, or the temperature's off. But right now we're finding everything goes into the nurse, right? Which you want a facilities person, you might want to adjust temperature. And so we're actually trying to basically make it a win-win where you might want to order a certain, dinner or diet or that. So we have an interactive patient care services. It allows you to order your meal, adjust the lighting, order things that would actually go to the appropriate person so that the nurse, when they're with you, it's focused on you and your health and your care. Rather than and then it allows you to have a care team surrounding you. So maybe it's the facilities person cleaning up the water that spilled on the floor, but it's a nurse taking care of you this way, and it's the dietitian that's getting you your meal. But right now, everything is going through one button to the nurse, so how can we triage that more appropriately? And what we're finding is we're trying to carve that time out to give the high touch part of it. So, but it is something that we're working with, but we're also, there are definite opportunities. And yeah, one question in the back.
I was just curious to hear more about how Kaiser is thinking about data that is gathered by wearable technologies and smartphone applications that aren't directly under Kaiser, and how you prioritize working with these new emerging startups.
That's a great question, because there's definitely a lot of wearables coming out in the market. So we actually have an API called KP Interchange. So we've done some pilots with kind of Fitbits, activity monitors from that. It kind of comes in for us to monitor your activity. We do challenges with our employer groups and things like that of getting everyone healthy. So when we're looking at that, so when it's like wellness, we're looking at that kind of monitoring. There's challenges, encouraging healthy behavior. So there's that kind of category of wellness. Then there's also this more clinical category, your heart rate. You might have just gotten heart surgery and just gotten out. You might have just gotten a hip replacement, fall detection. That goes into another level of monitoring per se. And we are actually doing pilots with our diabetic populations and doing remote glucose monitoring of them. And we're seeing the same dashboard and we're informing our patients rather than just a number, which to you might not mean a lot. We're actually visually showing of this is your threshold. If it goes below or above that, there's a concern. And we can see it when you can see it, and it's alerting us when you're going off of your threshold. But if it's within threshold, we're monitoring it and it's informed. But we're a partner with you as we're remotely monitoring some key vital signs in that situation. So I would say it's kind of, depending on the situation, the patient, we're monitoring in different ways. We're using APIs as a way to kind of engage and interface. Yes.
Thank you. A lot of the technologies are quite novel, but I wanted to ask about timing. When do you think many of the things we see on the screen will be, implemented throughout Kaiser Permanente's patient base? Let's call it 50% of the patient base. Is that a 3-year process or a 5-year, maybe 10-year process?
It all depends on the different technology. So with a remote tug, ones that are actually we have 12 of them already in operation, so they're here and now. And we have robotics in our large pharmacy fulfillment areas. I think what we're finding here, when you're starting to go to mobile diagnostics and mobile adherence, is FDA approval, right? So we're really looking for the FDA to approve and certify for us to be able to use broadly. So some are in still the research or FDA process, and that's really one hurdle that we want to make sure is safe for our patients.
Thank you.
Thank you. Yes, Margot from Oakland. I'm wondering about the Innovation Center, and to what degree is Northern California Kaiser committed to some of the new devices, or at least the customized medical devices, to having them not just prototype but manufactured here in the Northern Cal or in the East Bay? To what degree will you partner with firms so that we make sure that we take advantage of your supply chain and can produce some of these new devices?
Right. So we work together with the innovator. We, of course, encourage them, but since we are not the manufacturer ourselves, it's usually their business decision. But we actually have a whole initiative basically on supplier diversity and looking at it locally, but also having minority women-owned businesses as well, and really look to diversify our supply investment and making an impact in the communities we serve. So that is a major strategic initiative for us to invest in the communities we serve. Because we don't have any joint partnerships to create manufactured devices, we're more in providing care. We encourage them, but we can't manufacture them. So, and I think one more time for one more question. I'm on yellow now. So.
Okay, Danielle from Mars. My question is about privacy. In the last year alone, everyone from the White House to Target to JP Morgan Chase, one of the largest banks in the world, have all been hacked. So as I'm sitting here looking at all of these fabulous new technologies, the devil on my other shoulder is just thinking, with the exception of financial data, health data is arguably the most precious and the most, scary from a hacking standpoint. Just a use case could be someone could hack into your genomic data and then discover that you have a precursor for various diseases and choose not to hire you for that reason alone. So I'm just wondering if you could speak about privacy in your sector and in your own organization, and if maybe privacy could just be a larger conversation as we talk about innovating for the future, how we protect ourselves as we share all of this information.
No, privacy security is a very large concern. So we are actually only on private secure clouds. As we partner, we actually go through quite a detailed security clearance with some of our innovators, which is quite rigorous with third-party testing, protocol, even trying to hack into that system before we engage. From a Kaiser standpoint, we really value the privacy of our member data. Some might say to the point where, we're like, well, why can't you do that? Why can't you try this innovation? We're like, well, we do have some privacy concerns from this area. So we do quite a bit of testing before we bring it on. And even when we pilot, it's in a very secure, that's actually why we invested in the Innovation Center. It's secure off-site, not on our production systems, in a safe environment to test and innovate without accessing all our medical records. So, great. Well, thank you so much for your time. I appreciate it. We're going to be in the table in the back.